Hi everyone, thank you for tuning in. My name is Danny Anderson. I'm a third year PhD student at the University of Glasgow. Now today I'm going to be talking to you about how evaluability assessments can be used to foreground data-driven approaches for evidencing impact within dog population management. This work was conducted collaboratively with both my university and ICAM, as well as several other organisations, and we're going to be particularly focusing on help and suffering in Jaipur, India. I'll be mainly focusing on how evaluability assessments help structure and interpret long-term operational data sets to better understand program impacts. And if you're here from Bronte's talk, then thank you very much for swinging by. And if you've not checked hers out, then I highly recommend it. We're checking her work out along with Jai Dogs. So, we're going to start off with a challenge that many dog population management organizations face. Now, a lot of these organizations collect a lot of operational data, many over quite extended periods of time. This is things like the number of dogs neutered, vaccinated, rescued, maybe we've got street surveys. But this data is often collected primarily for program delivery rather than necessarily evaluation. For example, data may be recorded to help organizations track their day-to-day operations, um, and where dogs were getting treated. Those kinds of data sets are incredibly valuable, operationally, but they're not always designed with long-term evaluation questions in mind. So organizations may have years or even decades worth of data available, but those data sets may not be standardized, they may change over time, or they might actually just not necessarily align with the outcome the organization is interested in evidencing. Now, because of the limited time, funding, maybe even just experience, many organizations can struggle to fully use these data sets to evidence impact. And some organizations may not even have an explicit impact goal. Or explicit impact framework, even if they have an implicit goal that they are working towards. Um, so there is this gap that does need filled. And we are going to be talking about how evaluability assessments can be useful in filling this gap. So here is the process that we worked through with multiple dog population management organizations. So we sat down, we talked through sort of their goals, what they would like, and then after that, we developed a theory of change based on these conversations that we had with them. We then used this to help prioritize outcomes, sort of frame the questions that they are asking, and then sort of identify the data that they have and maybe any gaps in that data. After sort of working through all this, we can then do sort of some focused data analysis to sort of help them work out if they are actually meeting their goals. So let's talk a little bit about Help and Suffering, this organization we're sort of using as a case study here, based in Jaipur. Now, Help and Suffering have been operating since the 1990s. They do animal birth control through capture, vaccinate, neuter, release. They do rabies vaccinations. They have a little veterinary hospital. They do rescuing, rehoming, and some community education and advocacy. All of this is done in Jaipur, which is the capital of Rajasthan and has a very quickly growing human population that is currently sitting at around 4 million people. So after working with them, this is the theory of change we developed. I'm not going to go through all of this, so feel free to pause the video if you're wanting to personally look through each and everything. But what you will see is that there are a lot of outputs, a lot of activities, and quite a lot of outcomes that they're hoping to see as well. Now, what we did was we sort of focused these into some prioritized outcomes. You can see the sort of six here, the help in suffering really wanted to see. So we've got improved dog welfare, a reduced and then stabilized stray dog population, an increased and then a high maintenance of stray dogs that are vaccinated and sterilized, a reduction in dog and human rabies cases, a reduction in human dog bite cases, and reduced exposure and rabies post-exposure prophylaxis. So these are prioritized outcomes, but something that we did realize during this is that we cannot just look at prioritized outcomes. We have to look at the measurable outcomes. And unfortunately, we were not able to get human data from the government. So this does leave us unable to actually evaluate points 5, 6, and the human side of 4. Even then, that still gives us quite a lot that we can evaluate to see how well help and suffering are doing. So we had two main data sources for this. We had street surveys. These were carried out either once or twice a year. You can sort of see an example there in the top right. Here we count the number of dogs, what the sex of each dog is, male, female, whether they are notched, indicating that they are neutered and vaccinated, or intact, and in the female case, if they are also lactating. And we also count puppies as well. The second data source is the annual birth control data. So these are stray dogs that are captured by the HIS team, neutered, vaccinated. They're left to recover for several days. If any conditions, like health conditions, are noted in these dogs, and then they are sort of released. So having a look at this data, we can see this is from the street surveys. We can see that the number of neutered dogs starts very low at 3% at the beginning of this, but then gradually and steadily increases and sort of averages and plateaus out at approximately 75%. Doesn't match between males and females, with females plateauing in around 2003, with males following up at around 2008. But from then on, it stays stable at approximately 75% neutering in the stray dogs. We can see that as in the blue here, the number of female neutered dogs on the street increases and then stabilizes. The number of dogs that are seen in these street surveys decreases and then stabilizes, which is really good. That's exactly what we were looking for. And it sort of shows us that points 2, a reduced stabilized dog population, points 3, an increase in high maintenance of dogs vaccinated and sterilized, have been met, which is great. Oops. Now, if we look at the puppy population, we can see that now this is the orange line at the bottom here. It starts at about 19% of the stray dogs are puppies that are observed, but that very sharply decreases to 4% and then is followed by a period with no significant change. This is great as well. This also matches points 2 and 3 of a reduced dog population, and then the sort of maintenance of the sterilization dogs. If we look at the number of dogs that were captured for sterilization as part of the EBC program, we can see a very sharp increase, and then a sort of stabilization with an ever so slight decrease of 1% capture decrease per year, 0.5% neuterings per year. But this is to be expected as more of the population becomes stabilized and sterilized. And this is also great. As of the time that we did the data analysis, there were 94,000 dogs that had been neutered in Jaipur over this time. So a lot of hard work has gone into this. If we look at the number of rabies cases, there are two great graphs. The one on the left is the raw number of suspected rabies cases, and then the one on the right is the percentage of dogs that are suspected for rabies. You can see a great decline over this time, which shows an improved dog welfare, point number one, and a reduction in the dog human rabies cases, or in the dog rabies cases rather than human rabies cases. Um, so yeah, again, another point for help and suffering, and sort of showing how their work is contributing. Um, One of the more interesting findings was methodological rather than biological. Despite a declining dog population and what should be a healthier dog population along with that, we actually see an increase in the recorded conditions over time. Now, we had quite a lot of discussions with Help and Suffering about this data because this is an unexpected but very interesting sort of find from this. And over this, we sort of see that this actually more reflects an improvement in Help and Suffering's recording program of conditions, with the vet surgeons sort of becoming better at identifying these different health conditions and being more willing to sort of record and report them. And so this is actually a great case of sort of showing that they are improving um, in this, even though it may actually look like a negative at first. So if we have a little look at the help and suffering impacts, we can see that they're sustained. We can see a sustained sterilization and vaccination campaign that has been achieved. We see a reduction in the dog population and then a sort of stabilization from there. We've got an increased condition reporting, which was not something that we expected to see, but is actually a really good thing. And we see a reduced rabies incidence, which is great to see. Importantly, this work isn't just about producing statistical outputs. The evaluability assessment process helps clarify the outcomes. It identifies meaningful indicators. It sort of strengthens the interpretation, and it supports this organization learning. Um, it helps to foreground how existing operational data can be used to more effectively evidence the impacts and the desired impacts that these organizations have. Many organizations already hold valuable long-term data sets, and the evaluability assessment can help unlock the potential. So thank you very much for tuning into this video. I really appreciate it. As I said at the beginning, if you haven't already, please go and check out Bronte's video as part of this. She did a very similar process, basically the same process, but for a different charity, this one being Jai Dog in Thailand. Um, Yes, so thank you very much for listening. I hope you enjoyed. Um, and yeah.